Hey everyone, welcome back to Nursing 220. This week we're talking about the head, the face, the neck, and I wanted to show you guys a quick demonstration on how to perform the components of the physical exam for our course. So I have my son here. What's your name?
Elijah.
Hi Elijah, how you doing?
Good.
Good. How old are you?
6.
6. Wow. Okay. All right. So we have Elijah. He's 6 years old, and I'm going to demonstrate the components of the physical exam for our course, including the head, the face, and the neck. Okay. So first, what we're going to do, looking at Elijah here, I am inspecting visually with my eyes his face. And when I'm looking at his face, I'm looking at his expression. I'm looking to see if there's any asymmetry, perhaps like a droopy mouth or a droopy eye. And I'm not noticing anything like that. So I would say Elijah's face is symmetrical and it's not drooping at all on either side. And then next, I'm going to inspect and palpate the scalp, the hair, and the cranium. So looking at Elijah, I'm going to actually be feeling his scalp for any type of lesions, lumps, bumps, anything of that nature. And I'm not noticing anything unusual when I palpate Elijah's scalp. Moving on, I'm going to be checking cranial nerve number 5, and we can do that by asking the patient to clench their teeth. So, Elijah, can you clench your teeth like me? Like this. Good job. Cranial nerve number 5 appears intact. That's awesome. Good job, buddy. Next, we're going to check cranial nerve number 12, and we can do that simply by asking the patient to stick out their tongue. Elijah, can you stick out your tongue for me? Good job, buddy. All right. And notice how it is protruding midline. It's not drooping to one side or the other. Next, I'm going to palpate his sinuses. And we have both the maxillary sinuses and the frontal sinuses. There's a couple different techniques that you can use when palpating the sinuses. You could simply use your thumbs and palpate the maxillary sinuses or the frontal sinuses. Or sometimes people will tap the sinuses to see if there's any tenderness. So, am I hurting you, Elijah?
No.
No. Maxillary are above the cheek, and frontal are just near the eyebrow. Am I hurting you at all, Elijah?
No.
No? Okay, good. Perfect. Moving on down to the neck, we want to first inspect the neck. You're really just looking at the neck. You want to look to see if there's any sign of tracheal deviation, meaning the trachea is leaning down towards one side versus the other. There could be a serious lung problem if you notice tracheal deviation. And when looking at Elijah, the neck appears completely normal. I'm not noticing any tracheal deviation or lesions, scars, anything of that nature. Then we will test the ROM of the neck, also known as the range of motion. So Elijah, can you look up? Look down, try to touch your chin to your chest. Good job. Now look up at the screen. And are you able to turn your head side to side? How about looking that way? Can you look that way? Look that way? Good. Now look all the way over at me. Very good. And it looks like Elijah has full range of motion of his neck. I'm not noticing any limitation whatsoever. Moving on to cranial nerve number 11. We do this simply by asking the patient to lift their shoulders up and down. So Elijah, can you lift your shoulders up and down? Excellent. Cranial nerve number 11 is intact. Moving on down to the lymph nodes. So we have several different areas of lymph nodes. It's important to study the anatomy to know exactly where these lymph nodes are. So Elijah, I'm going to have you turn a little bit towards me. And we're going to start with the pre-auricular, which mean just in front of the ear. So palpating the pre-auricular lymph nodes. And then moving on down to the post-auricular, which means behind the ear. Palpating behind the ear, no lymph node tenderness noted here or bulging. And then moving to the occipital, that's sort of a fancy word for the back. And I'm feeling the back of his head and neck area here. I don't notice any lymph nodes. And the posterior cervical chain, which, Eli, can you turn your head towards me? Do you guys see this muscle right here? That's the sternocleidomastoid. Posterior cervical chain is going to be just behind that muscle. So I'm feeling on both sides, palpating for any lymph nodes in that area. And then also we have our anterior cervical chain, which would be, turn your head all the way this way, buddy, which would be in front of that sternocleidomastoid muscle. And I'm not noticing any lymph nodes in that area as well. And you want to do that on both sides. And then tonsillar, which is just in this general area where you think the palatine tonsils would be. And then the submandibular, which means just underneath the mandible, so, or the jaw area here. So I'm gonna feel submandibular. I don't notice any lymph nodes there. And then there's also submental, which means under the chin. So just palpating right under the chin. I don't notice any lymph nodes there. And then finally, supraclavicular. This means just above the clavicles. So I'm just gonna gently palpate right above Elijah's clavicles to see if I notice any lymph nodes, and I don't notice any lymph nodes. Next, we are going to inspect and palpate the carotid pulses. You wanna do this bilaterally, and you wanna do them one at a time. You don't wanna occlude both carotids on somebody. They could perhaps get lightheaded, they could pass out. We don't wanna do that to Elijah. So we're just gonna do one at a time. So at first, I'm inspecting the carotid pulse, and I'm looking right where the carotid artery is on his right-hand side here. And the pulse appears regular. It's there, I can see it. Sometimes you have to pay really close attention or adjust your lighting in order to actually visually inspect the carotid pulse. Now feeling the carotid pulse, I'm just gonna set my fingers right on the side of his neck. And I feel his pulse, it's strong, it's regular, doesn't seem too fast, doesn't seem too slow. And I'm gonna do the same on the other side as well. And that's it, guys. That's how you do the head and face and neck physical exam for this course. Thank you so much for joining us. And next, you guys will practice doing this and submit to me for review. Have a great week. Talk to you later. Bye-bye. Bye-bye, Eli.
Bye.